I'm Dr. Kevin. Thank you so much for joining me on this very important video about our functional medicine program. On today's video, I hope to lay out all of the possible things that we look for and the testing that we do to determine what your individual pathway may look like for you to be able to restore your health. One of the very first things that we have to do is we ask ourselves this very important question. Why are the cells doing what they're doing? And how do we get the cells to do something better and something different? Because understand, your cells are genetically programmed to perform a function. A skin cell protects, a nerve cell transmits, a stomach cell makes acid, a thyroid cell makes thyroid hormone, and this goes on throughout your entire body through all of its systems. It's not that you're just unlucky and are doomed to suffer with these things. Your thyroid doesn't just go on vacation and stop working. You don't have diabetes because your parents did. If you have something malfunctioning in your systems, there has to be an underlying reason for that, and we have to discover what that is and see if we can solve that. But we have to bring back some common sense to our healthcare system in America. America now takes 50% of all the pharmaceutical drugs on planet Earth, yet we are just 4% of the world's population. We have more doctors and hospitals than any other country in the world, and we spend more on healthcare than most of the developed world combined, yet China and Cambodia have a longer life expectancy than we do. So does Slovenia and Lebanon. In fact, we're ranked 38. At least we beat Cuba. Cuba's 39. And so we have to bring back some common sense whenever it comes to our healthcare in America. If the answer to achieving great health were doctors, drugs, hospital, and money, wouldn't we be ranked number 1 in the world as the healthiest nation on the face of the planet? Almost everyone we know has multiple conditions, taking multiple medications to cover up those multiple conditions, and side effects on top of side effects. Everyone we know is sick with something, and it's not supposed to be that way. We've so lost our health in America that we now think it's weird when somebody doesn't have anything wrong with them or they don't take any medication. So it's time to bring some sanity back into our healthcare program. We have to figure out what all of the underlying pieces are in your particular condition and with your particular problem. What are all of these underlying causative factors, and what do we have to do to start to eliminate those one by one and allow your body to be healthy the way it was designed? So whether you have thyroid problems, autoimmune disease, arthritis or diabetes, or anything else, this video will pertain to things that you can do to put your health on the pathway towards a longer, healthier life. Now, the absolute first thing that I must discuss with you today, before we get into all of the details, is everything that I'm going to talk about in this video has one overarching idea causing you not to be able to regain your health, and that's called energy deficit. I firmly believe that many people in America today are burning through their energy faster than they can make it. Your body makes an energy molecule called ATP, adenosine triphosphate. ATP is to your cells what gasoline is to your car. It's what fuels you. It is your energy molecule. Now, what I feel is that many patients can't be healthy because they're burning through their ATP faster than they're making it. It's burning through your energy faster than your body can make energy. And so, if you ask most people at the end of the day, hey, do you ever feel like your body has burned through more energy than it's made in a day? Most people will say, that's exactly how I feel. Well, that's because that's exactly what's happening. Because our bodies are dealing with more than they ever have in the history of mankind, and I'm going to go through some of those things today, but because we're dealing with more than our bodies have ever had to, and we're not really making it as good as we used to either, so we're not making enough energy and we're burning through it like crazy, and people are walking around with a huge energy deficit. And if we don't address that, if you don't address this energy deficit problem, you could be at the best clinic in the world, doing the best treatments in the world, and your body will never regain its health because it doesn't have the energy to do so. It takes an input of extra energy to go from this level of health to this level of health. Just like it takes an input of energy in your car to go from 40 miles an hour to 60 miles an hour. You have to burn more gas. You have to press on the accelerator. The engine speeds up. If you don't have the gas to do that, your car cannot accelerate. And that's what many people are dealing with their bodies. All of these things cause your body to have an energy deficit. And once that gets corrected, your body can continue to get better and better and start to go up this healing pathway. Now, some of the commonalities that's likely robbing your body of the energy that it needs to get healthy, number one is leaky gut syndrome. We're finding almost 100% of the patients that we test have this leaky gut syndrome. And I'm going to explain what that is. Also, you likely have high inflammation in your body. We're finding almost everybody that we test, their body is very inflamed. And I'm going to explain to you why inflammation stops your body from being able to get well and to heal. Also, you very likely have something we call stealth infections, which are hidden infections, hidden pockets of bacteria in your body, or viruses or parasites in your body that rob you of your ability to make energy. And then also, you very may well have some type of an unknown autoimmune reaction going on in your body. We're finding more and more autoimmune diseases today. And many times patients don't realize that they even have this going on, but we're finding them very often. There are now 188 autoimmune diseases and growing. A little fair warning here. If you have something complicated and your doctor checked and told you that it wasn't autoimmune, usually they check for two things: rheumatoid arthritis and lupus. If you don't have those two, for some strange reason, they tell you, well, it's not autoimmune. That leaves 186 other possible autoimmune diseases that they did not check for, and many times that's where the underlying answer lies. Many times, doctors don't even check to see if it is autoimmune, especially with thyroid. Why you would not want to know if a thyroid condition is caused by an underlying autoimmune problem, I don't understand. I see patients every week that have had a thyroid problem for 10, sometimes 15 years, and were just put on thyroid hormone to cover that up. But we actually find out that their immune system has been attacking and damaging their thyroid the whole time. And I want you to understand, if your immune system is attacking your thyroid, that's not a thyroid problem. That's an immune system problem. We're not even looking at the right system whenever it comes to these type of problems. Your thyroid is being damaged by your immune system, so we need to look and see what's making the immune system so mad and work on that. So they've taken a patient with a runaway immune system reaction, and they've just supplemented with more thyroid hormone, adding fuel to the fire. There's a lot of different cofactors that come into play whenever you start talking about these complex diseases. There's a lot of moving parts here. But if we're ever going to have a conversation about how to get you over something like this, you have to sit down and figure out what all of those moving parts are. What are all of the different cofactors causing these underlying conditions to take place in your body? So this video is going to be a little bit complex. I've made it as simple and as short as possible, but grab a pen and paper because I'm going to go through all of these underlying cofactors that we have to look for if we're ever going to sit down and have a conversation about getting you well. So let's start with the immune system. What autoimmunity means is that your own cells, your own immune system has decided that your tissue is a foreign invader like a virus, and it needs to go attack and kill your good tissue, your glands and your tissue that you need. Think of it like termites in your house, in your walls, eating your house up, and you have no idea. So make no mistake about it, when you have an active autoimmune reaction going on in your body, your cells are taking damage. So what would cause your immune system to do this? What happens is something gets inside your body that your immune system either doesn't recognize, it's too big to kill, or it's an inanimate object. And your immune system gets madder and madder and madder until it just has this runaway cascade reaction and it won't stop. Until you get that out, whatever's making it mad, it won't stop. In Hashimoto's disease, it's attacking the thyroid. In Crohn's, it's the colon. In rheumatoid, it's your joints. In lupus, the connective tissue. So an autoimmune disease is simply named by the tissue that is being damaged. But what they all have in common is that your immune system has gotten confused and it does not recognize part of you as being you, and it will turn and attack. Now, unfortunately, 50% of the time, if you have one active autoimmune reaction happening, you may have a second tissue being damaged or a second autoimmune reaction happening that you don't even know. Traditional medical treatment is to treat the tissue being damaged. So in Hashimoto's disease, if your thyroid is being damaged, they'll just give you more thyroid hormone. If your colon is being damaged in Crohn's disease, they'll do things to try to help your colon feel better. But at the end of the day, the culprit is your immune system. You have to look to the immune system to find out what's wrong if you're ever going to get to the bottom of this. Well, many times we find it on blood work. But a couple of tips here about blood work if you've had it done at your doctor's office. Several things. Number one is many times they don't do an extensive enough panel to find some of these underlying causative factors. They'll do just enough to determine what it is, but not enough to determine why it is. And that's really the critical difference. The other thing I see all the time is patients are told, oh, everything's normal, your blood work looked good. And I find multiple things wrong with it. My record that I've ever seen is I've found 12 things wrong with blood work that the doctor said, oh, blood work looks good, nothing wrong here. 12 things. So anytime you have blood work done, always make it a point to get a copy of that and look at your labs yourself, because the lab will show you anything that's out of range or not. And many times the doctors will go, oh, well, some people are just like that. Sick people are like that. They're like that if something's wrong. From a functional medicine perspective, if there's something wrong on your labs, that tells us something's wrong inside your body. That's what lab work is for. The other problem that I see with lab work real quick is many labs will use these huge ranges to determine what's normal and abnormal. For example, many labs will call normal thyroid from 0.3 all the way up to 5.6. But you can feel terrible at 0.3 or 0.4 or 0.5 or even 1.0. You can still feel terrible with thyroid hormone. So if you're 0.30, you're perfectly normal. But if you're 0.29, all of a sudden now you have thyroid problems. That doesn't make a lot of sense to me, and I honestly don't think it makes a lot of sense to you either. We use optimal ranges. So we're able to pick up problems that get missed so often by doing the type of lab evaluation that we do here. So be careful with this one page of blood work and looking at it 30 seconds and tell you everything's good. You deserve better than that, and that's why we do such an extensive process of testing here with our patients. There's a lot more than this, but I wanted to just touch on some of the top things with you guys. Some of the top things that can cause your immune system to turn and attack your body are toxins, infections, food intolerances, leaky gut, and inflammation. So I'm going to go through those things one at a time, but let's just start with toxins. If something toxic gets into your system, your immune system and your body will respond to that. Unfortunately, we live in the most toxic time in the history of mankind. The average American now eats 14 pounds of chemicals, toxins, and pollutants every year. So imagine the buildup of pollutants and toxins and pesticides and chemicals that we all have in our body. Getting rid of these things becomes a necessity. So another type of toxin is heavy metals. We find heavy metals in probably 60% of the patients that we check here. Heavy metals really mess up the way your system works on the inside. Mercury is one of the main ones. We find people really loaded up with mercury these days. I've had a couple of patients that their mercury level was so high, the lab was legally bound to call the Department of Health, and the Department of Health sent in investigators to look at these people's homes and do an interview to find out why their mercury level was so high. They weren't exposed at work. There wasn't a mercury spill or anything. It's just built up in their body. And these people were very sick. So where is this mercury coming from? Well, several places you could get mercury. One of them is dental fillings. They call them silver, but dental fillings are about 50% mercury. And we're carrying these things around in our mouths. And the International Academy of Toxicology did a review of these mercury fillings and found out that they can off-gas and vaporize and put mercury into our system. Now, the dentists swear these things are fine and there's no harm done. And there's mixed studies back and forth. But understand, these things are 50% mercury. And what I always ask my dentist friends, in order to kind of prove my point, I say, when these metals show up to your office, they just show up in an envelope? Oh no, they're in a complete like biohazard container. You have to open the box and there's all these regulations. The doctor has to be masked up and the staff, and there's all gloved up. There's all of these qualifications. Okay. What about when you take one of these mercury fillings out? You just throw it in the trash can or flush it down the sink? Oh gosh, no, it has to go back in a biohazard container, closed up, taped up a certain way. Okay, so these things are completely toxic, and then, as soon as they go in your mouth, they're not toxic. And then as soon as you take them out of your mouth, they're completely toxic again. I don't think anybody's buying that. I know I'm not. Fish is another place. If we were in California, every restaurant that had fish would have a sign on the wall that said, you might get mercury poisoning if you eat fish. And especially if you eat fish, beware of the apex predators, the tuna, the marlin, the swordfish, the sharks, because the mercury concentrates as it goes up the food chain. Flu vaccines are another one. All vaccinations, or most of them, have mercury in them. One flu vaccine has 25 micrograms of ethyl mercury. That's the type that goes right to your brain. It's the most damaging type of mercury that you can have out there. So just imagine that a piece of mercury breaks off in your body somewhere and lodges in your thyroid, which happens all the time. Now, your immune system is going to go try to kill that piece of mercury. You can't kill mercury. It's an inanimate object. So your immune system tries harder and harder and harder, and it gets madder and madder and madder until it starts damaging your own tissue. Lead is another one. Lead gets stored in our bones. It's very damaging. Lead really messes up the way your system works. It's one of the #1 reasons that we see couples have fertility problems and women have infertility, is they have a buildup of lead. 20 of the 33 major lipsticks that they tested had toxic levels of lead. Eyeshadows and mascaras, all of those type things have really high levels of lead in them. So you want to be careful with that. One study in the Journal of Environmental Health found that women that had high lead levels were 60% more likely to die from all causes. Just 60% more likely to die if you have toxic levels of lead. And we see that very often. The truth is, we are exposed to more toxins and chemicals from the time we wake up in the morning till we take our shower, drink our coffee, and leave our house, just in that hour in the morning, than our ancestors were in their entire lifetime. So keep in mind, we're discussing these problems in terms of autoimmune, but since we now know that almost all conditions have at least a secondary autoimmune component to them, each of these items becomes very important no matter what health condition that you've been diagnosed with or suffering with. So the next item that I want to discuss with you is something that we call stealth infections. A stealth infection is a low-grade hidden infection that you don't know that you have. So these infections aren't bad enough so that you have a fever and need to go to the doctor, but they also never go away. They're low-level infections that sit and fester inside your body, sometimes for years. Guys, listen, while we're on the subject of infections, I want you to understand that over the past 60 or 70 years, since the heavy use of antibiotics, the bacteria and viruses have been evolving to become smarter and more resistant and more difficult to deal with. And our immune systems are getting weaker and more confused and less effective. This is all starting to come to a head now with these resistant bacteria like this MRSA and staph and strep and MARCoNS. MARCoNS is a methicillin-resistant bacteria that you get in your sinuses. So you talk to these patients that say, well, I have a sinus infection and then it went away and then I got another one. Many times that's a stealth infection called MARCoNS that lives in their sinuses, and it doesn't ever go away. It just flares up and then goes into hiding and then flares up and then goes into hiding. It's called MARCoNS. We see that all the time. We've got a great product for it, but it's completely antibiotic resistant. But the bacteria have been evolving to become stronger and more resistant and more able to attack us. And our immune systems are becoming more confused and weaker and less able to defend us. So what do you end up with? All of these autoimmune problems, all of these antibiotic resistant bacteria, and it's gotten now to the point where it's one of the top killers in hospitals and in America today, these antibiotic resistant bacteria. So a stealth infection is a hidden pocket of bacteria that has gotten in your system, and your immune system either can't recognize it, it can't get rid of it, or it can't get to a place where it can kill it. Dental work is one of the #1 places that we find these hidden stealth infections, and especially old root canals and caps and crowns and these kind of things. So if you'll take a look at a typical tooth, at the bottom of the tooth you have these root systems. And what they do whenever they do a root canal is they'll come in and drill down in this root and then just cap the tooth. Well, the problem is that drilling will kill tissue in there, and they leave that dead tissue and cap over the top of it. This can create a pocket of rotting tissue and infection that can set and drip infection markers out into your bloodstream, sometimes for years. Another way that bacteria can get hidden inside your body is they now know that bacteria create something that I've been talking about for a long time called biofilms. What a biofilm means is you may have a little pocket of bacteria that has gotten in your system, and then it will create a biofilm around it that's like a mucus layer. And that mucus layer will protect it. No white blood cells can get past that in order to kill that hidden infection. Biofilms are something that bacteria have evolved and created, and it makes it very, very difficult for your body to get rid of bacteria in your system that are surrounded by these biofilms. So we have to figure out where these hidden infections are in your body and get rid of them. Because until you do, they will continue to steal your energy. Imagine every day when your body wakes up, it's going to war, costing you energy, costing you ATP. If you've got a limited number of energy and you're spending a portion of that on a hidden infection that's stuck away in your body somewhere, it's really hard for your body to heal until we find those and get rid of them. And next on the list is food intolerances. A food intolerance is a hidden irritant that your body has to a certain food that you're eating that you don't know about. And the problem with these hidden food intolerances is it can take up to 4 days for you to have a negative reaction to eating that particular food. So if you're intolerant to corn and you eat cornflakes Monday morning, and then on Thursday you feel terrible from it, that's a real hard connection to make. You know, people don't think, what did I eat 4 days ago? They think, well, what did I eat this morning? I didn't eat anything different. It must not be from my food. We have a lab where we can test you for 96 different food items to see if you may be eating something that your body is reacting negatively to. And the only way to tell is to do this testing. And that takes a lot of the guesswork out of it, because it might be corn or soy or dairy, but it might be broccoli. Who knows? You have to test these things out and then have a system in place to eliminate those foods. And lastly, let's discuss leaky gut syndrome. Leaky gut syndrome has now become the epidemic of our time. And the reason that is because we now know the herbicide Roundup or glyphosate rips right through our gut lining and creates what we call leaky gut syndrome. What leaky gut syndrome means is if you look at your digestive system and you look at your bloodstream runs very close to your digestive tract. And whenever you take a bite of food That food is supposed to be fully digested before it gets into your blood. So if you take a bite of chicken, that chicken should be fully digested in your digestive tract down to its smallest components, which in the case of chicken, that would turn into protein, which turns into amino acids. So you should have this fully broken down all the way down to amino acids, and then these amino acids get through this barrier and into your bloodstream to make energy. That's normal. That's what we want to see. Now, if you have what's called leaky gut syndrome, that means that this piece of chicken, because there's tears here along your barrier, this piece of chicken gets in your bloodstream early, before it's fully digested. And the problem is there's no mechanism to turn this into energy. So you lose energy here. Your immune system has to go attack and dispose of this as if it were a foreign object, which costs you energy. So you're losing energy here because you're not getting your nutrition, and it's costing you energy here to dispose of these food particles that are in your bloodstream early. Also, you can see how this would irritate your immune system, which would create autoimmune problems. And also it's very inflammatory, which creates tons of inflammatory conditions. Leaky gut is very prevalent in today's society. Almost 100% of the patients we test have this. The gut is a huge battlefront for where the quest for you to regain your health begins. We now know that 80% of the immune system takes place in the gut. Thyroid hormone is converted in the gut. Serotonin, which deals with anxiety, depression, takes place and is made in the gut. So the gut is a huge battlefront for where the fight for you to regain your health begins. So what do all of these things that I've discussed here today have in common? They all create inflammation. Almost every doctor you talk to, I don't care what his specialty, will agree that inflammation is the beginning of disease. But is inflammation a cause or an effect? Inflammation doesn't happen to a healthy body. All of the things that I've shown you here today all create the inflammatory response, which now doctors see create disease. So we're getting much further upstream than just to blame it on inflammation. Inflammation is very important. We have to get that inflammation out as quickly as possible. However, that's not what the cause is. The cause is whatever's creating that inflammation, and that's the ultimate point of leverage. But there's no doubt that inflammation stops healing. So there are stages of repair in your body. So think about when you sprain your ankle, it inflames first. That's one stage of healing. And then it repairs itself and actually heals after the inflammation goes away. And so if you constantly have these inflammatory chemicals being created throughout your body will never go into the repair phase because it thinks it's still in the inflammatory phase. So we always make it a point to check the inflammatory markers on our patients, and we find tremendous amounts of inflammation, and we've got to get that down as quickly as possible so that the healing process can begin. We find people very inflamed and often very acidic. pH is another thing that we really want to check. And pH means how acid or alkaline the fluid of your body is. And I don't mean stomach acid. I'm talking about the fluid that your cells sit in should be a neutral pH, 7.2. If you're acidic, meaning you have extra acid throughout all your tissues, that is a very diseased state to be in. Cancer cells love acid, arthritis loves acidic bodies, diabetes, and almost every other chronic disease really can set in if your pH level is too far tilted towards the acidic scale. So we always test these things out. I could keep going, but I think that's enough for today. I hope that you've been able to see how complicated your health problem may actually be. And I also hope that you've been able to see how a 3-minute office visit and glancing at one page of blood work to diagnose you with something for the rest of your life might not be the level of health care that you deserve. I spend hours with my patients and with their blood work and their file to try to figure out what all of these moving parts are and the best way we can address each one of these things at a time. And we always start with the main question I spoke about in the beginning. Why are the cells doing what they're doing, and how do we get the cells to do something better? Patients from all over Louisiana drive here to get evaluated by our system because of the thoroughness of our testing. And that's what it takes. You have to be willing to test all of these markers and causations out if we're ever going to get in the ballpark of fixing something like this. And once we put this strategy together, we have to begin to very methodically solve these things one at a time. For toxins, we have some of the very best detoxification units and supplements that can help kick that in, available anywhere in the country. And as far as infections go, we have a product that can kill stealth infections faster than anything we've found simply using oxygen. And for food intolerances, once we get the labs back showing what your body is intolerant to, I can work with you on a real easy nutritional plan so that we can eliminate those intolerant foods for a certain time, and then we'll try to add them back in so that your body is no longer intolerant to them. And for leaky gut, there's several things that we can do to heal this leaky gut syndrome in your body. It's not something that we say is permanently healed because Roundup is so prevalent in our food, you're probably going to get it again. So what we talk about with leaky gut is that we heal the gut lining and then we maintain the gut lining over the rest of your life so that it doesn't become leaky again. And for inflammation, you got to figure out why the body is inflaming. The inflammation is not the cause, but if we're going to spark healing, we have to get the inflammation down to give us time to work on some of these other aspects of the body. So again, thank you so much for listening today. If I decide to accept your case, it's because I wholeheartedly believe that you're in the right place and I can help you. And I don't accept everyone. I only accept those patients that I truly feel that I can help, but also I only accept those patients that I feel they are ready to take the commitment that it takes for them to get better. You know, we ask all of our patients here on a scale of 1 to 10, 10 being the highest, rate your commitment to getting rid of your problems. We only accept patients that say they're a 9 or a 10. And the reason why is because we're a 10. And if I'm a 10 and they're a 6, we're not on the same page. I care more about seeing their health restored than they do. That never works. It takes a dedication on your part if you want to come here and have us restore your health. What we do here is serious work, and we expect our patients to take it just as seriously. What we do here is very advanced, so I also need you to come with an open mind. And lastly, let's discuss finances, because I'm sure at this point you may be thinking, well, what about my insurance? Will they cover this? Well, they may cover some of it, but a lot of it likely they will not. And if you're one of those patients who kind of has the attitude of, well, if my insurance doesn't pay it, I'm not doing it, then unfortunately the bad news is you're probably going to remain unhealthy. It's not your insurance company's job to pay everything that you need to do to regain your health throughout your whole life. Insurance companies don't want to pay for kidney transplants of somebody that's dying in bed. It's really unfair and unlikely that they're going to want to pay for you to come do things that's going to truly restore your health. Now, that's not to say that we won't work with you. We have some fantastic programs here to try to make our care affordable to everyone. But it's important that you understand what an insurance company's job is actually to do. An insurance company's job is to return as much profit to their shareholders as possible, and the way they do that is by charging you as much as possible and paying for as little as possible. So I want you to come with an open mind about your insurance and finances as well. Like I said, we will bend over backwards to try to help you, but don't expect your insurance to pay for everything. And lastly, I need you to be willing to invest some time in our treatment. I understand everyone is busy, and we have patients drive from all over Louisiana and even some other states to come here. But it's the nature of what I do. If you're going to come here for treatments, you have to physically show up here. I can't give you a little bottle of me to take home and take whenever you need it. You physically have to show up here in order to receive some of the treatments that we do. Now, I don't know how long your individual treatment program will take. We would have to sit down and figure that out one-on-one. But everybody wants to come here once, have me snap my fingers, all their health problems go away, and then they go on about their life. And unfortunately, it just doesn't work that way. I don't have a magic wand, but we will figure out your individual pathway for you to achieve a higher level of health. So if you already have an appointment with me, thank you for that. I look forward to seeing you. If you don't have an appointment with me, I would love a chance to sit down with you one-on-one and have a discussion about how my methods might be able to help you. So you can give us a call at 983-CARE and we will schedule a time where you can sit down and we can spend about an hour together figuring out what your individual pathway might look like. Thank you for joining me. We'll see you soon.